as part of Mentoring Medicine's biomedical internship, Lab number 3, also known as BioX, has completed a research project labeled Does Pollution Affect Our Mental Health? I am Nazine Shah, a college freshman and the moderator of this lab, and I'll be accompanied by Ashley and Hetty.
Hi, my name is Ashley Choi, and I work at SYP, and I am a college freshman.
Hi, I'm Hetty Trivedi, the project manager, and I'm also a college sophomore.
So the more we learn about mental health, the better we can provide helpful support to those in our lives who struggle with mental health conditions. A mental illness is a physical illness of the brain that causes disturbances in thinking, behavior, energy, or emotion that make it difficult to cope with ordinary demands of life. It really represents our emotional and psychological well-being. Pollution, on the other hand, falls under a few categories. One being air pollution, which evaluates the release of harmful chemicals in our air. Now we ask ourselves, how does this affect us mentally? As we already know, it affects us physically through heart attacks, strokes, diabetes, and respiratory diseases. The objective of our project is to identify and understand the intersectionality between mental health and pollution through public opinion and outreach relating back to our question. The majority of these individuals agreed that pollution affects our mental health. However, a number of participants kept a neutral standpoint.
To conclude, as discussed in the results, the agree category had the highest and the strongly agree category had the lowest votes, which might be because of the insufficient knowledge of our participated audience on the issue. The trend shows that the audience only has general idea of the correlation between pollution and mental health, since there were no competitive answers for strongly agree or strongly disagree categories. Additionally, bias was also evaluated due to the share of the Google form with only certain individuals.
For the future research, we concluded that pollution should be monitored so that there is no need for future research on how it affects mental health. Scientists should find methods to decrease air pollution to a level where people are not adversely affected.
Closing off, I would like to thank Mentoring Medicine and its biomedical research internship for this opportunity, as well as fellow interns and friends.
Today, I will present about the COVID-19 cases by race or ethnicity in the state of Michigan from the beginning of 2020 to the end of 2020. So as you can see, this graph represents the cases in white non-Hispanic population, and the rest represent COVID cases by minorities. So with the white non-Hispanic population, you tend to see like most notable peak in November, whereas in the rest of the minorities graphs, you see the multiple peaks. For example, for cases in Black non-Hispanic population, you see peaks in April, in July, and in December, while cases in Hispanic population, you also see peak in May, July, and November. So this is the health disparity. So COVID-19 affect different populations differently.
Hello, we are Lab 2 Rising Phoenix, and our research focused on the impact of health inequity that alters our eating habits. This research poster was made by Jonathan Zhang, Kelvin Reynoso Jr., and Nuha E. Our research topic developed after we conducted our first research project on zip codes. After collecting information about health outcomes in different zip codes, we found that the location of where you lived affects your health. With this information ruminating in the back of our minds as we continued our days as biomedical research interns, we were eager to explore the whys behind where we lived affecting our health. After analyzing some research articles, we decided to focus on diet, which is one of the major factors that contributes to your health. With further extensive research, we found that an eating habit that consists of a majority of fast foods rather than homemade cooked meals can detrimentally affect your health, with increased risk to chronic conditions. It may seem that the easiest solution to maintain a healthy diet is just to eat healthy food, but it is not that simple. The food environment where one lives influences their eating habits and in turn their diet. Different neighborhoods have different ratios of fast food restaurants to grocers, resulting in eating habits that affect the health risk of those individuals. People who live in insalubrious food environments may be unaware of the extent that their eating habits are indirectly being affected by where they live. The problem lies in the infrastructure of New York, where there is an uneven distribution of resources that limits the availability of healthy food options. Our goal is to bring awareness and change to those regions that are significantly impacted by food health inequity. We want to spread awareness through social media to garner a large audience and contact elected officials to push for infrastructure policy change.
Our hypothesis is that areas with lower ratios of fast food restaurants to grocers will result in healthier individuals than those areas with higher ratios. Our thought process was that since fast food is unhealthier than food from the supermarket, an individual who eats more fast food than grocery food is unhealthier and has increased risks of chronic conditions. Therefore, a location with a higher prevalence of fast food restaurants will create an environment where individuals have less healthy food options and are more inclined to consume unhealthy fast foods. We gathered our data using 2 ways. Our first way was through a primary source where we conducted a survey and sent it to a large base of survey recipients. With this data, we determined the different eating habits of the individuals in different areas. Our second way of gathering data was through a secondary source where we performed our own literature review to analyze, synthesize, and interpret data on comparison studies, research papers, and published data reports. With this research data, we identified the regions of unhealthier individuals and factors that may explain those unhealthy regions. By evaluating our data, we drew correlations between the infrastructure of those regions and the diets of the individuals who live there to determine regions at risk of health problems. Our survey question was, on a scale of 1 to 5, I often eat at a fast food restaurant over eating food I bought from the supermarket, with 1 being strongly disagree and 5 being strongly agree.
Our research started by compiling the retail chain location data from the Center for an Urban Future to create a choropleth map of different regions in New York. We focused on the ratio of fast food restaurants to grocers and wholesale clubs to better understand the food health inequity in different boroughs of New York. The darker region signifies a higher number of fast food restaurants compared to grocers and wholesale clubs. Our data shows that the Bronx has the highest fast food restaurants to grocers and wholesale clubs at a ratio of 97 to 1. This means that for every grocer and wholesale club in the Bronx, there are 97 fast food restaurants. After researching about fast foods and their effect on our body, we found that a fast food diet contains high sodium, saturated fat, trans fat, and cholesterol, which can lead to an increased risk of high blood pressure, heart disease, and unwanted weight gain. Having knowledge of health outcomes of New York from our zip code project, we postulated that an unhealthy fast food diet from the high ratio of fast food restaurants to grocers and wholesale clubs in the county contributed to Bronx being one of the unhealthiest counties. From our literature review of characterizing Saskatoon's food environment, the neighborhood-level analysis of in-store fruit and vegetable access by Sugandhi Del Canto, Rachel Engler-Stringer, and Nazim Muhajareen, we found that wealthier and higher socioeconomic status neighborhoods had access to healthier and more nutritious food options, while lower socioeconomic status neighborhoods lived in food deserts, where people had financial difficulty in acquiring healthy food. Higher socioeconomic status neighborhoods had a higher proportion of grocery stores, while lower socioeconomic status neighborhoods had a higher proportion of convenience stores. Socioeconomic factors include occupation, education, income, wealth, and crime, which are all affected by where you live. By analyzing the social and economic factors in New York counties from our zip code research, we discovered that the Bronx had the lowest socioeconomic status among the counties, and Manhattan had the highest socioeconomic status. With our zip code research and our literature review, we were able to determine that the Bronx, a lower socioeconomic county, was a food desert and had a lower proportion of grocery stores. This literature review supported our hypothesis that a lower prevalence of grocery stores would create an environment difficult to obtain healthy food options.
We analyzed the health disparities in New York by comparing eating habits of people living in different areas and how it affects their health. The Bronx is a food desert, and due to the environment they live in, they struggle to find affordable, healthy food options. The Bronx had the highest rate of fast food restaurants to grocers and wholesale clubs, meaning that individuals are likely to consume an unhealthy fast food diet over a cooked homemade diet from grocery and wholesale clubs. The unhealthy diet contributes to many chronic health conditions.
We aimed to improve the infrastructure of the Bronx community by contacting elected officials to implement more grocers and wholesale clubs in the Bronx. By spreading awareness through social media, we hope to inspire New Yorkers to choose healthier options from grocers rather than fast food restaurants. We are also proud of mentoring in medicine that we are with and support our research. Thank you very much for taking the time to watch our research presentation.
Hello and welcome. My name is Yandel Morel and I'm presenting information on life expectancy by region, and this was done for my specific zip code, which is 11106. So here we have a bar graph and I plotted the different regions and the life expectancy for each region in years. So this first blue graph is for Queens County, and more specifically it includes my zip code. And the life expectancy is shown to be 83.85 years, which is about 84 years. Next, we have the information for New York State, and the life expectancy is 80.5 years. For the United States as a whole, the expected life expectancy is 77.3 years. So you can see that overall, as you zoom out, you could say, and include the rest of New York State and the rest of the United States, the life expectancy goes down, and it goes down by a lot. Comparing 83.85 to 77.3, that's a significant difference in life expectancy. So this led me to ask my next question, which is why? Why is there such a significant difference between the life expectancy of those here in Queens, those in New York State, and those in the United States? So a few of the things that I could consider and could potentially do further research on is walking versus driving. So here in New York City especially, everything's close by, so walking is part of our daily lives here. When you go out into the suburbs and less urban areas, driving is essential, and many people drive every single day. So having the opportunity to walk here in New York City, that could greatly positively benefit our health. So that's something to consider, and it might explain this difference in life expectancy. Another thing to consider is the quality of the water. New York City especially is just known to have good access to water, and unfortunately this cannot be said for the rest of the United States. The water quality changes depending where you go, and some areas unfortunately do not have consistent access to clean water. So I think that's something that can be researched and can affect life expectancy. Another factor to consider is access to health care. So this is a big one because here in New York City, it's a large city. It's one of the largest cities in America and in the world. So we have so many resources in terms of healthcare. There are numerous clinics, numerous hospitals to access, and numerous financial programs that can help with healthcare costs, as well as everything just being within walking distance. You know, you can take a quick 10-minute taxi to the hospital if you need to, right? Like everything is nearby. You don't have to wait 2 hours to go to the hospital. And unfortunately, as you move out of the cities and into the suburbs and rural areas, access to healthcare isn't always guaranteed. It may be far apart. It may just not be the best quality for you. So this is a big factor that can affect life expectancy. But with all that said, I just wanted to demonstrate the life expectancy for these three different regions. And I also cited my source here at the bottom. So thank you very much for your attention, and I hope you have a phenomenal day. Okay, hello and welcome. This is a weekly update for Lab 2. So on Monday, we condensed lab members from different labs. So we have a total of 10 members now, and our members are from Lab 7, 24, and 27. Together we make Lab 2. And these are the names of each of our members. Not everyone is able to attend every single day, but we are in contact through our Discord channel. So we have 2 research posters that we were doing this week, and the first research poster is on exercise and the immune system. This was primarily done by the original members of Lab 7, so this week they were focusing on adding more graphs and numerical data to their poster. So Research Lab Poster 2, this was focusing on exercise and diabetes. This was done by the original members of Lab 24, but now everyone else is contributing as well where they can. And we were focusing on conducting a Google survey research form to collect our data, and we were also condensing our information onto the poster. Next, we worked on a research proposal, and we started by finding a literature review paper that was related to exercise and diabetes. We found several terms and medical terminology from the paper, and we wrote down their definitions. And then after that, we completed the research template, which was also based on exercise and diabetes. Lastly, we created a Future Me post. So this was a social media post that included a picture of us, and it included our goals for the future and where we wanted to work and what career we wanted. And these posts were individual, so everyone from the lab had to do their own. We also had 2 very wonderful guest speakers sharing their professional journey. We had Joshua Almeida. He is a medical student studying in Ecuador, and he was in his final year. And we also had Dr. Sean Johnson, who is a doctor of physical therapy, and he is working with professional baseball teams and helping them with their physical therapy. So just as a side note, I didn't include any pictures of our work because we have a lot more that we wanted to add, especially to our research posters. And also we wanted to keep it a surprise. So thank you for listening, and I hope you all take care.
Where can I exercise in Staten Island, 10312 zip code? There is Laredo Parcel, a 15-minute walk away from Annandale train station. Let's go. It is off of Laredo Avenue between Annandale Road and Mott Street. Hi, Mr. Hedgehog.
Welcome to Laredo Parcel. This local 2.2-acre gem of an NYC park is a delightfully scenic walk or hike.
That was both good exercise and relaxation. Thank you.
using Powtoon. Created using Powtoon.